Bern University Hospital in Switzerland. Dr. Pilgrim will present the BIOSCIENCE study, a randomized comparison of a novel ultrathin stent. Dr. Pilgrim.
Yes, good morning. Mr. Chairman, ladies and gentlemen, it is my privilege to present the results of the BIOSCIENCE trial, a randomized comparison of a novel, ultra-thin strut biodegradable polymer sirolimus-eluting stent with a durable polymer everolimus-eluting stent for percutaneous coronary revascularization. My conflicts of interest are displayed on this slide. So progress with metallic drug-eluting stent has involved refinements in all three components of drug-eluting stent, in the stent platform, in the polymer, and in the anti-proliferative drug. So this slide now summarizes the principal features of the two stents used in the BIOSCIENCE trial. The Orsiro stent has a cobalt chromium stent platform with a strut thickness of 60 micrometers, a passive coating with a silicon carbide layer, and the biodegradable poly-lactic acid polymer eluting sirolimus. The Xience stent also has a cobalt chromium platform, but with a strut thickness of 81 micrometers and a durable polymer that elutes everolimus. This slide summarizes the trial design and the patient flow. The BIOSCIENCE trial was a non-inferiority trial with minimal exclusion criteria. Between February 2012 and May 2013, 2,119 patients with stable coronary artery disease or acute coronary syndromes undergoing percutaneous coronary intervention were randomly allocated in a 1-to-1 ratio to treatment with either the Orsiro stent or the Xience stent. Randomization was furthermore stratified according to center and according to presence or absence of ST segment elevation myocardial infarction. Clinical follow-up was performed at 30 days and at 1 year, and the primary endpoint target lesion failure was a composite of cardiac death, target vessel myocardial infarction, and clinically indicated target lesion revascularization at 12 months. So baseline characteristics were well balanced between the two treatment arms with respect to age, gender, cardiovascular risk factors, and previous revascularization procedures. Of note, more than 50% of patients were presenting with an acute coronary syndrome. This slide here summarizes now the primary endpoint results. So the cumulative incidence of target lesion failure according to Kaplan-Meier estimates amounted to 6.7% among patients treated with durable polymer everolimus-eluting stents, and to 6.7% among patients treated with biodegradable polymer sirolimus-eluting stents. Non-inferiority for biodegradable polymer sirolimus-eluting stents was established with an absolute risk difference of minus 0.14% and an upper limit of a one-sided 95% confidence interval of 1.97% at the p-value of 0.0004. Subsequent superiority testing did not show a significant difference between the two treatment arms. There were also no differences with regards to individual components of the primary endpoint between the two treatment arms. A stratified analysis of the primary endpoint showed consistent results across major subgroups such as diabetes, acute coronary syndrome, off-label use, gender, and renal failure. A pre-specified subgroup analysis among patients presenting with ST segment elevation and myocardial infarction showed a lower risk of the primary endpoint target lesion failure among patients treated with biodegradable polymer sirolimus-eluting stents as compared to durable polymer everolimus-eluting stents at the p-value of interaction of 0.014. So in conclusion, ultra-thin strut biodegradable polymer sirolimus-eluting stents were non-inferior to durable polymer everolimus-eluting stents for the primary endpoint target lesion failure at 1 year in a population with minimal exclusion criteria. The observed benefit in the subgroup of patients with ST segment elevation and myocardial infarction warrants confirmation in appropriately designed studies. The BIOSCIENCE trial is being published today in the Lancet Online. Thank you for your attention.
Thank you very much, Dr. Pilgrim. So the publication is on Lancet.
Exactly, it's a simultaneous publication online today in the Lancet.
A very significant journal, of course. So this presentation is related to a kind of a new stent, a little bit very specific area. Do you have some questions here? Please, identify your...
I just wondered, what data is there for the stent on stent thrombosis or very late stent thrombosis?
Exactly. Thank you for the question. That's an excellent question. So there are no significant differences in the rates of definite stent thrombosis nor in the rates of probable or definite stent thrombosis. So the rates of definite stent thrombosis were 0.9% among patients treated with biodegradable polymer sirolimus-eluting stents and 0.4% among patients treated with durable polymer everolimus-eluting stents. However, this numerical difference was not statistically significant.
Somebody else, please? For Dr. Pilgrim.
In a sense, what we're seeing here is biodegradable polymer. So what does that mean for the biodegradable stents that are in development? This held great promise. Looks like now maybe it won't pan out?
Well, thank you. So the trial was designed as a non-inferiority trial, as most of the recent stent trials, because of excellent clinical outcome of newer generation drug-eluting stents. Most of the recent trials have been non-inferiority trial. However, for example, we do have those stents do have a potential to show superiority during extended duration of follow-up. For example, the LEADERS trial, also comparing biodegradable polymer drug-eluting stents, and published 2008 in The Lancet, compared this biodegradable polymer stainless steel drug-eluting stents compared to the durable polymer Cypher stent, so the sirolimus-eluting stents. It was a non-inferiority trial, proved non-inferiority at 1 year. However, after 4 years and after 5 years, we observed a reduced rate of very late stent thrombosis. So also if this stent, which is kind of the next generation combining a durable polymer with a very thin, an ultra-thin stent platform, may have this potential to have a benefit during long-term clinical follow-up, as it has been shown that this biodegradable polymer may attenuate this inflammatory response after a stent implantation.
Great. Somebody else, please? If not, thank you very much.